Okay, oops. Hi, everybody. For some reason, we are having. So I want to thank everybody for being here today, and we are going to get into the Insider for Power Hour today. I am going to share my screen. And we'll do our housekeeping here. So today is September 8th, 2021. I am your host, Lisa Cernka, nurse practitioner, and I want to welcome everyone to our group visit today. Let's see if I can, there we go. The group visits provide an additional opportunity for you to connect with me and my team. We're experts on a weekly basis to learn and add information to help you on your health journey. It's an educational presentation or a guest lecture, and the first 30 minutes is recorded and placed in the Solutions Learning Library. You have access after the fact. And the format can be either a lecture style with various subjects, a lab review, Q&A session, or a lecture series. The closed group discussion is the remaining 30 minutes, which is not recorded. It will be a guided discussion, and your participation is optional. However, it can be very insightful. So what are the rules? So we want you to be curious and open-minded and realize that everyone's at a different stage in their journey. We are all students in learning, and no one has all the answers. We understand that emotions are welcomed and embraced, but we want to think in terms of gray thinking, not black and white or absolutes. And then one last thing, understand that when you're in the closed group meeting, that everyone will hear what you say, and other people may disclose their private medical information or social information. Please keep that confidential, respect privacy, be attentive and curious, respect other people's journeys, uphold diversity and practice non-judgment, show encouragement. Changes happen on a different timeline for everyone, and be open to learning new things. So that is where we're at. So let's get to the topic today. Expectations. So there's a whole story as to why I picked this topic today. So expectations, I don't know if you've ever heard the saying, those who expect nothing are seldom disappointed, right? And I thought about that, but then I thought, well, aren't expectations what drive us to try something new or continue on a path? So if you think about expectations in your life, and keep this in mind, because this is what we'll be talking about in the closed group, is when have expectations moved you and propelled you forward? And when have expectations held you back or deflated your forward progress? And I'm going to talk about that a little bit more in depth, and how this approach and this concept of expectations can either propel your progress in functional medicine in reaching your health goals, or create a roadblock. And we'll talk about that in a little bit in detail here. I'm going to stop sharing for just a second and get to my next screen. So what brought this all on for me was I have always wanted to make sure that people understand that expectations, and I think it's my job to make sure that expectations are reasonable when we're dealing with chronic health conditions. So one of my mentors uses a timeline, a treatment timeline. And so this is his treatment timeline, and I'm in the process of fine-tuning mine, and this is not the final one. But I thought, well, wouldn't this be great? Because I'm always talking about rebuilding the foundation of your house, and we'll get to that graphic in a minute. But What is the expectation? When am I going to start feeling better? When am I going to start seeing changes? How will I know if this process works for me, right? And I think everybody who comes to functional medicine has that question and then has this kind of expectation. Now, these are estimated treatment timelines. A lot of things will influence whether or not you move to the next step, right? Depending on how your body responds. If we find something that is concerning or acute and you need to kind of break from functional medicine for a while and go to an acute care provider and then come back. And when we start working together and go through what the potential underlying causes would be for your chronic conditions or your chronic symptoms, and we start to kind of peel those layers away, that's when we get into how long will this take, right? Why is it that adrenal support or calming down that stress response can take 3 to 6 months? And why would I need to do it a second time, right? So understanding the treatment timeline and building upon one step after the other so that we can get long-lasting treatment results and really get you back to wellness, right? This is a wellness approach. This is a health approach, not an acute care health issue. Although in some cases, we are dealing with some acute care issues like candida or pathogens like H. pylori or a parasite, something of that nature that might need some assistance with acute care while we continue our path. So I'll bring this up again when we get into the closed group, because I'd really like to hear everyone's input about what they think about this. The other thing that I noticed is that when I start working with someone who's very new to functional medicine, if we do too much too quickly, like too much of the testing, and we start to evaluate some of these really big tests like the functional medicine NutrEval or the organics acid, even the GI effects or GI map, those stool testing at some point can be very overwhelming and not really understanding how does all this fit together? Where is Lisa looking for guidance and how is she formulating these treatment plans? So I think that when I look at how I approach treatment and slowing things down just ever so slightly so that we layer things in the appropriate manner so that you actually get used to what we're talking about when we're talking about adrenal testing and supporting the adrenal glands, and doing that on a very focused format for a couple of months. And then we step into the next step, which is the stool testing. And then the organics acid or the nutrient testing. So does that mean we can't do adrenals and maybe some liver support, detox support at the same time? No, it means we can collectively do some preliminary things together, but full-on treatment may need to be done in a very stepwise fashion. And I hope this approach, if you've been working with me for a while and you have some insight into this, would be very helpful, because understanding this stepwise fashion and then understanding why this is not a very quick result. This takes some time. As you can see, we can take up to 12 months, sometimes 18 months, depending on what we find and how your body responds to those plans. So I don't even have on here, which I might add later, is small intestinal bacterial overgrowth. If that is indeed a problem, that takes a little while to rebalance and refocus. So understanding those processes is important. One of the other things that I think we need to talk about, and let me just get back to this here. This is this graphic that I keep coming to, but I've never really taken a super deep dive into what this means in conjunction. If you put this together with the timeline, it may bring into focus for you why things aren't a quick fix in functional medicine. Now, remember, functional medicine is bringing you back to health and wellness and full function. That can take a while. And when we talk about the foundation, I often say that I'm a foundational functional medicine practitioner, but of course, I'm looking at your entire house, understanding what the triggers and the patterns are, and how did your foundation get cracked? How did your foundation get into jeopardy? And if we start down here at the bottom and we look at your gut, but we also look at your triggers, your emotional, your physical, your hormones, antibiotic stress, illnesses, all of these things, all of these triggers create a pathway, a series of events that happen. And you often have heard, and if you've been working with me, you understand this whole fight or flight or HPA axis response. So I'm going to show you a nice graphic here that I will probably be putting on the website. So this is the fight or flight over here on the right where it says sympathetic. And when your brain perceives any one of those triggers that threaten your foundation, it creates this response. And it does this forever to exhaustion until the brain decides that that trigger is minimized, managed, or gone. So think about that just for a second. And if you look at, some of you may be having these symptoms now or had them in the past, rapid heart rate, increased weight gain because you have a lot more glucose running around, insulin resistance, stomach, inhibiting the stomach and the intestines is super critical. This part right here is super critical because it can contribute to a lot of the problems that we see in the gut. Constipation, diarrhea, and you can get diarrhea because you're flipping back and forth. You can have both. You have insulin resistance, you have leaky gut, you have food sensitivities. That's why this gut is one of the foundational things that we look at. Inhibiting urination. A lot of people will have bladder spasms, right? Sexual dysfunctions. And then when we are in a state of calm, which is the parasympathetic, things start to go back to normal. But you can imagine if you're constantly flipping back and forth between these two, how uncomfortable that would be. And then also understanding what happens when you stay in this state of readiness, right? So why do I bring that up? Well, because if we go back to our timeline, and may have just answered our question here about why we need such a long and concentrated effort to support our adrenals and reduce this fight or flight and sending into a state of calm. And then why would we need a second round? Well, anytime we do something that's stressful, like removing pathogens, like trying to reset the gut, then there is a whole new set of stress response that the body will go through. So although the gut is foundational, I do, in my mind, put the two of these together because if we cannot put tools in our toolbox to make sure that our adrenal glands and move us from a state of excitement and readiness into a state of calm that we start to get more calm timeline, calm time in our stress response, then we're constantly fighting the adrenals. I hope that makes sense. And we can talk about that a little bit. So how do we keep this on track? Well, we use some tools. One is we use the MSQ. This is a tool that I'm developing, and this will be every person's homework as they start working with me in every follow-up plan, because what I have found is that sometimes we maybe spend a little too much time talking about supplements. Maybe we spend a little bit too much time talking about food, but we don't talk about other things like, what is your body awareness of your symptoms? And how do we use that as a tool? Stress management is really mission critical, and it often gets pushed to the side because it's difficult. And it's hard for people to understand, how do I manage the stress? It's always here, right? Emotional stress, environmental stressors, toxin stressors, physical stressors. How do we put this stress management in plan? It's a big chunk, right? And then your nutritional tools, if you're on a very specific diet, that we're trying to create healing with that food plan, then really focusing on that too, and making sure we're optimizing that and using all the tools. Then your movement. Some of you know you're not ready for movement right away. And then we have to constantly assess, when are you ready for movement? And then of course, supplements. Supplements are not the key to all this. I want to be really clear about that. Supplements are a tool, but they have a purpose, and they should have a start date and an end date. But we do have to understand whether or not the supplements are complementing what we're trying to do. And then the 4 C's is really what I should put down here at the end, that we talked about a couple of visits ago, was what creates success, right? This communication, this commitment, coming to the classes, doing all the things that we need to make sure your plan, which is this 6-point functional benefit, which is really your plan, that is very customized for you. And so I'm using this as a tool so that prior to coming to a visit with me, you'll be able to weigh in and put some information in here and know that Lisa's going to ask me about my stress management plan. What did we do last month when we talked? What did I pick up when I was in the group meeting? And what am I currently using? What's working well for me and what isn't? And then we'll go through each one of these particular functional medicine benefits. So those are some of the things that I am working on. And I'm working on actually customizing this timeline. And we'll talk about it in the group meeting. And we'll talk about, if you think this is a good idea, and what has been your experience, and what would you have liked to have seen a little bit differently. So I appreciate everything that everyone can bring to the discussion, and we can bring to the closed group, so that we can have and help people on their journey, enhance your journey, so that you can get long-lasting results that will keep you on the wellness path forevermore, and not stuck in the acute care sickness, and only reaching out for healthcare when there's a crisis. And crisis healthcare, that's where we want to move away from. So I'm going to stop now